Director General Dr. Mkhize, my colleague, the Minister for Higher Education, Science and Innovation, Honorable Nzimande, Cabinet colleagues, ministers and deputy ministers, the Director General for WHO, Dr. Tedros Ghebreyesus, the AU Commissioner for Human Resources, Science and Technology, Professor Sarah Agbo, all distinguished panelists and participants and members of the media, ladies and gentlemen. It is indeed an honor to participate in this exciting initiative, and I'd like to open by extending my heartfelt thanks to the Honorable Nzimande and his department for the work that has been done in the organizing of this conference, which, as he indicated, we're sharing as the two departments. South Africa finds itself in the midst of an unprecedented global crisis, which saw the novel coronavirus mushroom in China and spread ubiquitously across the planet in 7 short months, reaching a total of 17 million cumulative cases and over 675,000 fatalities. Its clinical manifestations have been mind-boggling, affecting pulmonary, cardiovascular, neurological, musculoskeletal, and other systems, thus mimicking different medical conditions, with the resulting mortality being compounded by pre-existing conditions, which we call comorbidities. This has meant, therefore, that the best response to deal with this crisis is interdepartmental and multisectoral, which the National Coronavirus Command Council, headed by our president, represents. Worse still is its impact on society beyond health. The pandemic has affected social, political, economic, and other aspects of our lives, changing them for good. We identified our first patient on the 5th of March, and from that first case, we are alarmed to witness a doubling time of 2 days, and we're compelled to move swiftly and decisively to institute a hard lockdown on the 26th of March. The lockdown was undeniably effective, as we observed an increase in doubling time to 15 days, with demonstrable flattening of the curve. We needed time to prepare our health services to be able to manage the large influx of patients during the inevitable surge. However, after 5 weeks of hard lockdown, hunger, lack of food and income security resulted in social and economic distress, and it became necessary to focus on saving both the lives and the livelihoods. Thus began the differentiated approach of easing restrictions through our alert level systems. We embarked on this reopening of the economy with the full understanding that an increase in the numbers of cases was inevitable. Indeed, we have seen an explosion in the numbers to reach 482,000, with over 400,000 of these cases being registered in the past 2 months. Despite this huge surge that made South Africa rank the 5th highest in positive cases in the world, we have reasons to be hopeful. We have mobilized support from medical experts who advise us on protocols to put in place for containment, to control cluster outbreaks and guide day-to-day management. We have received international support through various advisories and webinars, and particularly the reinforcements by experts from Cuba and the WHO. May I, Program Director, take this opportunity to welcome and pay tribute to the Director General of WHO, as well as the regional director and the local country director for the outstanding support that they've given to the Department of Health and South Africa in general as we battle this very difficult pandemic. But we have reasons to be hopeful, because lessons on case management and discovery of effective medications such as dexamethasone, the early use of oxygen, and other treatment regime has resulted in mortality consistently below 2%. Our current fatalities stand at 7,812. We are determined to save all lives, and one loss is a life too many. We extend our condolences to all South Africans that have lost loved ones due to COVID-19. Secondly, the recovery rate is encouraging. It has increased to 64%, where it was about 47% about 3 weeks ago, indicating that more people have overcome the infection than those who get new infection and test positive. Thirdly, current data shows an encouraging trend. Western Cape has passed the peak and maintained a plateau for the past 2 months, whilst early indications of promising decline are observed in the Eastern Cape and Gauteng. Other provinces, of course, still drive the increasing numbers. For these reasons, we have to intensify the non-pharmaceutical interventions and emphasize behavioral change to force the reduction of new infections in all provinces. As such, we've established a multi-sectoral ministerial advisory committee which focuses on grassroots mobilization for behavioral change. This seeks to forge collaboration with behavioral scientists, civil societies, communities, traditional leaders and healers, religious organizations, labor, and all stakeholders who are able to effect change at local community level. We continue to manage a number of concerns and challenges, like increasing bed capacity to manage the surge is an ongoing battle which we are winning so far. Triaging mechanisms and facilities ensure that we combat nosocomial transmission. Contact tracing for quarantine and isolation remains key to breaking the cycle of community transmission. We have now augmented our track and tracing functions by introducing a digital system called COVID Connect to deliver the test results and where users can interact with the healthcare system on a digital platform for case identification, tracking and tracing, and referral to quarantine and isolation or hospitalization. Resolving the strain on personal protective equipment availability due to high demand, overutilizations, sometimes poor quality and corruption, price gouging, maldistribution, giving urgent attention to innovative stock surveillance solutions in order to protect our health workers as they are the backbone of our health services and also to avert unnecessary labor disputes. We are increasing human resources for health for all categories and expediting the filling of vacancies and recruitment of new staff. Additional ventilators and oxygen supply is pivotal, and National Ventilator Program is an important development in this regard. A total of 2.9 million tests have been conducted, increasing testing capabilities beyond our community screening program. Allowed us to identify low and high transmission zones. The targeted testing strategy we adopted was necessary to optimize the use of available resources in the midst of a surge. Antibody testing will still be very necessary in assessing community impact. Participating in trials, for example, the Solidarity Trial by WHO for therapeutics and the ChAdOx1 study for the vaccine development is extremely important to position our country favorably for access to these tools. When they become available on market, it is for this reason we're investing a huge amount of resources to safeguard our future. And my colleague, Minister Nzimande, has touched on this particular matter, as well as the President also highlighted the need for equitable access to both vaccine and therapeutic agents. We need to build a strong base for pharmaceutical manufacturing capabilities and new technologies for vaccine production, diagnostic kits, and production of various medical equipment, including ventilators, PPEs, and others, and embracing telemedicine and various new innovations. The South African Health Regulatory Agency or Authority stands ready to fast-track all applications that promote development of local capabilities. This conference is therefore timeless, as it allows us to open up a wide variety of disciplines of scientific research and harness expertise to advance solutions to combat COVID-19 and strengthen health systems and other systems in society. It will be key to take every opportunity to progress towards universal health coverage. At this point, therefore, I'd like to take the opportunity to thank His Excellency President Ramaphosa for his unwavering support and stewardship as we ride through this storm. We commend our President for the outstanding leadership. President Ramaphosa has led from the front, mobilizing all spheres of government and various sectors of society and galvanizing all our energy, focus, and resources to mount a formidable fight to defeat COVID-19. This has given our people hope and courage and determination to defeat COVID-19. I also therefore want to thank all my colleagues, my cabinet colleagues and in government, as well as the people of South Africa for responding so positively to a very difficult campaign for behavioral change in order to defeat COVID-19. I want to endorse this conference, and I really hope that out of this, more innovative ways will be brought about to help us to mount the most effective response and fight to defeat COVID-19. Program Director, at this point, I want to thank you very much and thank you all for participating in this very historic conference. Thank you.